The goals of surgery and artificial disc replacement is to, first off and primarily, remove the neurocompressive pathology if there's any. Secondarily, to reconstruct the disc and maintain appropriate parameters of disc height and range of motion, optimizing the end plate coverage to minimize the risk of subsidence. Optimizing motion has a number of factors, and it has to do with balancing the soft tissues, just like any other joint arthroplasty. Knee replacements, hip replacements, their stability and their function is based in large part about the soft tissue balancing around the implant. So similarly, in a disc situation, you don't want to over-distract or stuff the disc space because you're going to limit flexion in that way and increase loads on the end plates. You want to have the prosthesis placed in a position where it's neutral, and what I mean by that is that the neck is in a neutral alignment and the disc has parallel end plates. That allows range of motion to occur in all the engineered ways that the disc is supposed to function. So you should be able to have extension, flexion, rotation, and tilt. We're now trialing a size 3, the largest footprint. The coverage is very good. One of the things we do is the setup to the patient to get that into the neutral alignment so that we know we're not putting it into a bent spine or something already in extension, because then we'd have to do a lot of compensation to try to get it balanced. So you start in a neutral position and try to get it sized appropriately so that the end plates are parallel and not lordotic or kyphotic. Once you get the leading edge in, close down the cast bar pins. So the hole looks round there. My anesthesiologist says I'm straight up and down. All right, looks good. It looks like it's cutting well through here. We'll keep going. Still take it farther back. So a small nerve hook here. We're ready for our implant. We wanted these sharp little edges here to go on top. The dome is on the top. We place it in the disc space. We check again, make sure we're straight up and down. Take a shot of that. We're seeing the core here, and then this is the peak covered with the titanium. So you can see there's little peaks there, and so this is the shadow image of the end plates. So the back edge of it is right there. Just simply turning that wheel, and there we go. And then we have a final inserter. Take a little picture. That looks pretty good. It's getting there. I like it a little farther back if I can. And that's about where it's going, it looks like. So then we check the depth. If you can't see the titanium coating, you can check with this depth gauge. Okay, I've just taken the traction off of it. So what we're seeing here is the core, and you can see that the end plates are fairly parallel. So there's room to move into an extension and flexion. So it flexes down and moves up, and looks like it's centered side to side. The current patients that I have in the Simplify study are doing excellent and are not having any problems at all. So I'm just very excited about the clinical results that we're getting with this product.